Asphyxia is a condition characterized by the lack of oxygen, and that can basically result in the unconsciousness of a person and even the death of the person. So, whenever we are looking for the signs of the asphyxial death in a dead body, that are again very common. For example, it can be edema, it can be cyanosis, and all of these signs have to be documented in detail by the person in the autopsy report. So, what signs we have to look for in the asphyxial death? They are the mainstay over here in this section. Now, in this section, we'll be dealing with the petechial hemorrhages, which is again a very important sign of the asphyxial death over here. Then the congestion is again another sign of asphyxial death. Edema is basically the swelling of the tissues, and it's again very important over here. And then the cyanosis, it is basically the bluish discoloration of the tissues. Then the autopsy diagnosis, how are we going to diagnose that this person died of asphyxia? This is basically all of the collection of all of these signs in a person, and then the histological and the chemical markers are again very important whenever we are documenting any death which was caused due to asphyxiation. These histological changes have to be marked by the chemical pathologist to whom we are going to send the tissue samples, and then the chemical markers, of course, the blood samples have to be sent to the chemical pathologist, and any changes at the level of the blood have to be documented if there are any to mark the asphyxial deaths. So the clinical signs of asphyxia are again very important. The absolute diagnostic quintet. Now, as I was already telling you, the common signs of asphyxial death that are usually marked as the they are of high significance. For example, the petechial hemorrhages, the edema, the swelling, the engorgement of the veins, the engorgement of the right side of the heart. All of these are basically termed as the signs of asphyxial death. The cyanosis, even the bluish discoloration of the skin seen in the face, especially the edema seen in the face, especially the typical edematous appearance of the face. The facial features are usually swollen in an asphyxial death. They're usually marked as the mainstay whenever we are diagnosing any death which was caused due to asphyxia. But again, there are a lot of pathologists that usually argue to these signs, and they say that there can be any other condition even apart from asphyxia which can lead to these signs. So basically, it is a very complicated kind of a condition right now. So even the pathologists are working on the factors that there can be any chemical changes which occur at the level of the blood, which can relate to the asphyxial deaths. So it's basically these signs which are termed, and these basically arguments which are termed as the absolute diagnostic quintet, and they're basically the part and parcel whenever we are dealing with any asphyxial deaths. So these are basically these arguments that we are dealing with whenever we are referring to these diagnostic quintets. Now, the petechial hemorrhages. Petechial hemorrhages are the small pinpoint collection of the blood lying in the skin, the sclera or the conjunctiva, and under thoracic serous membranes such as the pleura or the pericardium. So they are basically what we are dealing with whenever we are talking about the petechial hemorrhages. Obviously, there are other conditions even in which these petechial hemorrhages can be seen. For example, it can be some blood disorders which can cause these petechial hemorrhages. Again, the person can be suffering from any CVAs or any high blood pressures. So even in those cases, these petechial hemorrhages are seen. This is basically what the pathologists argue about, that the petechial hemorrhages are not only significant for the asphyxial kind of death, and other pathologies or underlying conditions can even contribute to the formation of these petechial hemorrhages, even in the thoracic serous membranes of the pleura and even the pericardium. Now, size from 1/10 of a millimeter to about 2 millimeters. Now, if larger, it is called as the ecchymosis. So the coalition of these petechial hemorrhages is causing these ecchymosis. Now, the Tardo spots is another terminology or another name for the petechial hemorrhages, and sometimes a terminology even used in the autopsy reports. So what happens here is there is an acute rise in the venous pressure and the over distension and the rupture of the thin-walled peripheral venules. and which is followed by the hypoxia of the vein wall is an added factor for the formation of these petechial hemorrhages. This is the underlying pathology for the formation of the petechial hemorrhages. Now what happens here is the strangulation by either hand or the ligature. So it can be a manual strangulation, or it can be manual strangulation was regarded as the throttling phenomena, and then it can be a simple strangulation phenomena. Which can cause the occlusion of the jugular veins, prevents the venous drainage from the head. The arterial supply continue via the carotid and the vertebral arteries, and there is a rapid rise in the venous pressures in the head. Then we have the engorgement of the veins, which is seen in the neck and which can be seen even in the face of the person, and the swelling of the tissues is caused over here, which is followed by the increase in the intravascular volume and the rapid transudation of the fluid into the tissues. So this is basically the basic pathologies or the underlying events that are occurring whenever the petechial hemorrhages are formed. The petechial hemorrhages is and unsupported areas are the most common areas. For example, the eyes or the surrounding areas of the eyes. These are basically covered with the softer tissues, and these are the areas which are mostly where we find these Tardu spots. So what is basically the significance of these petechial hemorrhages? The cutaneous and the visceral petechiae, they appear and enlarge as a post-mortem phenomena. So this is basically why we signify these petechial hemorrhages. Now the number of the petechiae is a function of the post-mortem interval. So the number of petechiae and even their location, and even whether they are coalesced or whether they are not. When they are coalesced, they are basically known as the ecchymotic areas. And if we find the ecchymotic areas, it means that a period of around 3 to 6 hours have passed. So the posture affects the appearance of the hemorrhages, and this is very important over here. It is present in the normal post-mortem hypostasis even over here. So it is not quite significant to the asphyxial deaths, and even in the normal post-mortems, these petechial hemorrhages or the Tardu spots are found even in non-asphyxial deaths. It is an unreliable indicator of the asphyxial deaths, so we cannot really rely on these methods. Now the congestion and the edema. The congestion and the edema is basically, how do you differentiate between congestion and edema? Edema is just the swelling of the tissues, and congestion is the swelling of the tissues along with the discoloration. It is a non-specific method. This is the edema. It can be found in other types of death even, so it is very non-specific. And the results of the obstructive venous return, this is basically the underlying pathology for the formation of the edema and the congestion. The redness and the swelling is regarded as the congestion of the tissues, and the internal organs also become congested and strangulated. In case this edema and congestion has formed externally, even the internal organs can be congested in these tissues. Again, the edema results of the rapid transudation through the capillary and the venule walls, and the hypoxia of the vascular endothelium is increased usually due to the increased permeability of the venous walls. Strangulation is basically the tissue fluid escapes rapidly into the brain whenever the strangulation phenomena occurs. So what happens here is there is a hypoxia as an additional factor whenever we are talking about the strangulation, and pulmonary edema is also seen in the strangulation death. And there is an excess fluid to enter alveoli whenever we are talking about the deaths due to strangulation. Now, cyanosis is basically the bluish and the purplish discoloration of the skin or the mucous membranes due to the tissues near the skin surface having low oxygen saturation. There should be a low oxygen saturation and a bluish discoloration. So these are basically the mainstays for the process of the cyanosis. It can occur even in the face, it can occur in the nails, and especially in the peripheral parts of the body. The cyanosis process basically starts off whenever there is a asphyxial or the hypoxic condition. Now, the engorgement of the right heart and the fluidity of blood is another marker, which is the highlight for diagnosing the asphyxial deaths. It is a non-specific autopsy sign. Again, it can be found in even other modes of death, and the abnormal fluidity of the blood can be seen in any other forms of death apart from asphyxia. Post-mortem clotting in heart and venous system is again going to cause an engorgement of the right heart and the fluidity of the blood, and the engorgement of the chambers of the right side of the heart and the great veins is again seen in a lot of other modes of death apart from asphyxia. Autopsy diagnosis of asphyxia, first of all, we have to get a careful history of how the death occurred. The circumstances of death have to be observed. In some cases, we can get our hands on, for example, the plastic bags or anything that we find at the crime scene can contribute to diagnose whether the death was through asphyxia or not. Then there can be an exclusion of the other causes for the death. The cautious evaluation of the classic signs is observed over here. So we cannot really rely on these conditions, that is the edema and the cyanosis. So we have to move on to the histological and the biochemical diagnostic markers. The histological changes in the lung are again very important. The chemical markers in the blood or the vitreous, such as the hypoxanthine, is the mainstay for the asphyxial death, and it's basically very important and is raised in asphyxial deaths. So the clinical signs of asphyxia that are observed in a person dying of inadequate amount of oxygen supply to the blood tissues are very important, and that are discussed in detail in this section. That was the end to this section. Thank you for watching sqadia.com.